The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. We're glad you're with us today, and we're glad that Dr. Alan Handysides is with us today. Welcome.
Thank you very much.
And I think I said that right, Alan Handysides, right?
That's right, Alan
And
Handysides.
your specialty really through the years has been with dealing with mothers and with kids, maternal health, obstetrics, gynecology, and pediatrics, isn't that right?
That's right.
But now you're more involved in a global health ministry. You're working in many countries around the world.
I'm very privileged, actually, to be the General Conference Health Ministries Director for the Seventh-day Adventist Church worldwide, yes.
All right. Now, one of the concerns, many times on Health for a Lifetime, we have dealt with, I guess we would call them the diseases of affluence, Western society, that type of thing, where we have stores, we have things all around us that we can easily access. But one of the huge concerns we want to talk about today is AIDS. And what exactly does AIDS stand for? What does it mean? When did it start?
Well, AIDS stands for Acquired Immunodeficiency Syndrome.
Which means in simple...
Which means in simple language that you don't have the ability to fight infections. You've lost your defense system. And it's caused by a virus called the human immunovirus, HIV, of which there are two types, 1 and type 2. And type 1 is by far more prevalent than type 2.
Now, how long has this been around? When I was growing up, I didn't hear much about this. How long have we known about this?
Well, neither did I hear much about it, but of course I'm older than you, so it was on June 5, 1981, that there was first reported in the Center for Disease Control bulletin, which they put out every week, 5 cases of pneumocystis carinii infection, which is a very rare pneumonia, or was a very rare pneumonia, in 5 young homosexual men. And the writer had also identified that they had lost their usual immunity. So this was not something they were born with.
So when was this again?
In 1981. So this is the 20th anniversary of the recognition of AIDS.
Okay, so about 20 years ago this happened.
20 years ago.
And where was this? Was this in this country?
This was in San Francisco.
Okay.
In this country, North America.
So AIDS was not around before 1981?
Oh, it was around, but it wasn't recognized.
Okay.
In fact, it was very interesting. It took about 3 or 4 years before they identified the virus. I remember them talking about whether it was caused by cytomegalovirus or all kinds of strange and wonderful theories as to how it was coming about. But then finally the organism was identified, and then antibody tests were developed against that virus that showed that there was a response against it. And then by looking at stored serum samples, they were able to identify it as far back as 1959.
So stored blood samples, you mean by that?
Stored blood samples from mysterious disease, deaths from unknown causes.
All the way back to 1959. Amazing. So where exactly did this get introduced to the human system?
Well, the geneticists who've looked at this, now using DNA techniques and so forth, the geneticists have said that it probably was somewhere in a 50 to 70 year spectrum. So maybe going back to the 1920s, 1930s, when it first came among humans. But it's thought that this is a mutation of a virus from chimpanzees that gained access to the humans.
So some people ate some chimpanzees, or what happened? They got bitten by a chimpanzee?
Maybe bitten by a chimpanzee, and the virus, that particular virus happened to have this ability to exist in humans.
What is, here in the United States, what is what are we dealing with here in the United States, then maybe around the world? But what's the new case infection rate here in the United States?
Well, actually that's falling, which is good. The new cases are falling in the United States. The virus is the same. The mode of transmission varies from place to place. About 47% of AIDS or new HIV cases in North America are homosexually transmitted. That's men having sex with men.
Only 47%.
About 47%.
It's a large percentage, but
that's right.
Some people think it's 100% from that.
Not at all. Probably 28%, 29% is transmitted by sharing of needles among the drug culture.
Okay.
Probably 12% is transmitted by heterosexual activity, and then the remainder is from blood products, contaminated instruments, needles, and so forth. That's different from Africa. In Africa, it's about 95% heterosexual transmission.
95% heterosexual. Okay, in other words, a man and a
having
woman.
intercourse with a woman.
Okay,
yes.
and so many times people will attach a lifestyle or a certain stigma because they say, well, if they have AIDS, they must be doing this or that. But what you're telling me is not necessarily.
No, not necessarily at all. In fact, heterosexual transmission in Africa, one could acquire it from a blood transfusion and transmit it in a marital situation without understanding that it had even been there, without any marital infidelity, without any of these usual stigma that we try to place on people.
And then what about children that
Vertical transmission. A mother who has HIV, when she comes to deliver her baby, she has about, untreated, 24-25% chance of transmitting that to her baby. With new medications, that can be reduced to probably less than 7%. But of course, those medications are not available in Africa.
Talk to me a little bit more about Africa. I mean, I want to get a sense of the global perspective here. And, we have to keep in mind that there are folks in all of these countries that may be watching this program. And so, when you visit those countries, what are you seeing there? What's your impression of the situation there?
Well, I'll tell you, it's not a pretty picture. The continent of Africa is probably the place that you see the most devastation. We're losing 5,500 people a day.
A day?
Just imagine that, 5,500. Funerals every day. Every day, day in, week out, month in, month out. That's been going on.
All from AIDS?
All from AIDS.
So when we have a plane go down, we have a big accident here, say in the Western countries, sometimes I guess, back at Gettysburg, talking about the history of America, you lost about 7,000 folks. You have a huge monument and all kinds of things, and people wrote songs about it, but every day you lose that many people.
I was at a hospital, one of our Adventist mission hospitals in the country of Zambia, to the east side there, Chipata. And there they have 150 beds. I asked them, I said, how many of the patients here have HIV, are HIV positive or have AIDS? 75%. That day, they tested every blood sample that came to the lab, and it was 100%
100%?
positive. 100% positive. Just devastating. It's unbelievable almost.
Is there any hope? Are they developing any vaccines? Are they developing any medication to give some hope?
Well, there is hope, and there's a tremendous amount of resources have been deployed to look at this. And I would think of single conditions. Probably there isn't a single condition that's ever had as much attention as has HIV and AIDS. It's not been available yet that there's a cure. Vaccines just recently have been used on monkeys, and they've had some positive reports, some good reports. Actually, just in the New England Journal of Medicine, they reported that infection with hepatitis virus may confer a degree of protection against HIV. So there's interesting new work that's coming to
So
light.
get hepatitis and have
if
some
it's
protection.
if it's the right type of hepatitis. So that sort of work is coming to light. The biggest step forward, I would say, has been in highly active antiretroviral therapy, which has been able to reduce the number of virus particles in the blood and prolong life probably up to 4 or 5 years for the HIV-infected person.
Let me unpack that a little bit for maybe some folks that are not so medical. We talked about 2 different things you mentioned. One was a vaccine. What's a vaccine in just layman's terms? And then the next big words you used. Unpack those for us.
Well, if we were to look at a vaccine would be, well, this virus causes the body to develop a response against it because it's wearing a blue coat.
Okay.
So let's take the blue coat and inject the blue coat into the individual, and they'll start making
antibodies
protection against the blue coat, which in turn will kill the virus. So that's a vaccine.
Okay.
Infection with another virus, obviously that virus is somehow competing with the HIV, and in that way slowing down the HIV. So you've got a warfare going, a competition between 2 viruses. And so that's how the one virus is working against the other.
And so then the medication type thing, it slows down the process from another angle?
Yes. You see, the HIV is what we call an RNA. That's a ribonucleic acid virus,
okay,
as opposed to deoxyribonucleic acid. That ribonucleic acid virus is a retrovirus in that it has to be converted back to DNA. RNA and DNA are kind of mirror images of each other. Mm-hmm. And so the reflection into the DNA is made by an enzyme, reverse transcriptase. It goes into the nucleus. The nucleus then starts producing more RNA. It produces rolls, if you want to think of large toilet rolls of RNA. Mm-hmm. And then in order for the virus particles to be broken off the roll, like we take a slice of toilet paper, there has to be an enzyme called a protease enzyme. So if 2 enzymes that are key, reverse transcriptase,
that gets it back into
getting
the
it
DNA,
back to DNA,
and
then
the other one,
protease chopping it off. And the chemists, the biochemists and the researchers in these big companies have produced inhibitors, reverse transcriptase inhibitors and protease inhibitors, and they've slowed the process down.
Okay.
But they haven't been able to stop it.
So what they've done is HIV just very simply comes into the body from whatever way, and it tries to get inside your cell. Is that what you're saying?
What it does,
and it slows that process down, and then it slows the process coming out of the cell and being spread out like seeds, if you will.
That's right. So the virus comes along, it attaches to specific cells, CD4 cells. That's what CD4 cells. It then pops inside the cell, it's reverted back to the DNA, switches the cell machinery, the DNA starts pouring that, and then as it comes out, it's got this like chopper,
and it
little
goes into other
pieces
cells.
coming out, and then it goes to other cells. Do you know one virus particle in 4 hours can replicate itself 2,000 times? Wow. Do the arithmetic on that.
So that's exponential after.
36 hours, you've got billions upon billions of these virus particles in an individual's life.
But at this point, what we're saying is the only thing we have medically is to slow this process down, and to slow this process of coming out and getting chopped off
That's
down.
Right.
There's no real ultimate treatment, but we've been able to slow it down, in a sense.
There is a treatment, you know. Prevention.
Right, once you have it. Okay, now let me talk about this a little bit, because lots of people are very frightened when they hear that someone has AIDS or is HIV positive. How is it transmitted practically, and what should we be watching for before we go to our break?
The virus, HIV, is a very fragile virus. Very fragile. Mm-hmm. In fact, bacteria or germs or anything that is sexually transmitted are usually fragile. You put them on a dry surface, they die. They're done for. They require the intimacy, the moisture, the warmth of the sexual encounter to transmit it, because they only live in human body fluids.
Okay.
So the transfer is of human body fluids. If we take whole human body fluids as a blood transfusion, or serum or plasma, where that...
What about saliva?
It's possible through saliva, but not, it hasn't been documented.
Okay.
Perhaps one case has been there where they think it might be from saliva. Then you need a broken surface so that it can get across, and that's why aberrant sexual practices sometimes help it to come across.
So like a bleeding or something.
Bleeding, cuts, laceration. That's where healthcare workers who have cuts should wear gloves so that there's no broken hangnails, or it can get in through the skin, and that's how it's transmitted. As I said earlier, 95% it's heterosexual transmission, intercourse in Africa. Here, of course, it depends because of the relative proportions being different, but it's still transmitted sexually by and large for the most part.
We're talking with Dr. Alan Handysides. He is the actually medical director, health and temperance director for the Seventh-day Adventist Church. We're talking about AIDS, and when we come back we're going to look at some pictures, and we're going to talk about some hope at the end of our program. We hope that you can join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Alan Handysides from the General Conference of Seventh-day Adventists. We've been talking about AIDS, a worldwide epidemic. We learned about it first as to what it was here in America, but you've shared some hope with us that the process of AIDS can be slowed down, but the bad news is once you have it, there's actually really no known cure. And as we were talking last, you said, look, there are certain ways that it's transmitted that would lend us to really want to listen when there's a message that says prevent this rather than catch it. We have a couple pictures that come to us courtesy of the Adventist Development Relief Agency, ADRA, and we want to look at those right now. Maybe we can talk about them a bit. The first one here is, let's see, a picture of actually a person that has AIDS. What do we see in that picture? They're a little emaciated. They have, look like they've thinned down. Is this a typical look for someone that has this particular situation?
Yes, I think that this is a rather good illustration, actually. It's a woman who is probably about 32 years old. Mm-hmm. She's in the prime of life. She has children. Her husband will have died. Mm-hmm. She will be HIV positive. We can surmise she may have caught it from her husband. She may have given it to her husband. That's really irrelevant to the discussion. Mm-hmm. She probably is going to die and leave her children as orphans.
Will they have HIV?
Depending when she acquired it, some of them may. She may have lost some children from HIV because 25% of the babies born to HIV-infected mothers, I'm using that as a ballpark figure, will be positive for HIV themselves.
Now, does that come as a result of them having breast milk from the mother?
Well, about 22% of them will acquire it in the birth process. That's why medication is really required to be given to pregnant women during pregnancy and during childbirth. If we could do this, we could lower that 22% down to about 7 or 8%.
And when you say medication, that's the same kind of medication they use to treat it?
That's the same sort of medication as they use to treat it, although not for as long a period of time, usually not in such combinations as heart therapy, highly active therapy, and there are very reasonable medications available to do that. So, you know, that's something that needs to be looked at very closely. Then the breastfeeding is the other tragedy. Years ago, a woman who did not breastfeed her baby had a 1 in 5 chance that her child would survive the first 2 years of life. Now, if you take that backdrop, and then you say, what percentage of these mothers are going to have their babies infected? And it's going to be somewhat of the magnitude of maybe 25 again, 30% of them will be infected if they continue breastfeeding. It's an awful dilemma.
Because they don't really have any other way, probably in these countries, to feed the child.
To feed the children. So here this is one of the real tragedies. How do we feed the children? How do we avoid them being getting AIDS? It's just a dreadful, dreadful scenario.
We want to look at another picture here as well. What exactly is it that we're looking at here?
We're looking at a field hospital setup. A health worker is trying to take care of the dead and the dying.
Comfort the dying. Comfort
the dying.
Which this is always a terminal illness, ultimately.
Once they get to late stages, it's terminal. It's absolutely devastating to watch these people die. I remember seeing a 22-year-old dying with cryptococcal meningitis, and I actually went to give spiritual care. I wanted to pray with the person, and I found that she was beyond prayer because she was just so mentally and confused, just disabled, unable to do that, which to me is a very important lesson. We need to show our compassion and our caring while these people are still able to receive it.
Because once again, what you were saying, if I understand it correctly, is that, okay, many times we'll stigmatize people because we think, well, if they have that disease, they must have been involved in this or that behavior, but especially when we're talking about these countries, what was it, 95% contracted this through, you know, normal
sexual
activity that was, you know, not aberrant or something like that. And so they really can't be held accountable to that particular standard or that particular way of looking at things.
Yes. I think we have to be like Jesus. When that woman came to Jesus, they said, this woman's caught in adultery, you know, all the finger-pointing clerics.
Right.
And Jesus said, there was no question about the guilt or otherwise, but there was the compassion. Woman, where are thine accusers? You know, neither do I condemn thee. Go and sin no more. I think we have to relate to people where they are. The past is not our business. We're people of the future, of hope. And we need to take it wherever we find people and to work with them, bring them the promise of salvation from that point on.
Speaking of that, I mean, we're thankful today for these pictures from ADRA, which is part of the church's response to this. But what is the church, the Seventh-day Adventist Church, doing to address this global concern?
Well, if we were to talk of ADRA, ADRA, of course, is an arm of the church and has been involved in many, many projects in Africa, in South and Southeast Asia, in Eastern Europe, to the tune of millions of dollars worth of projects. But this is sometimes not recognized as being the church. And as a church, we have recently recognized there is a great need for us to become cohesive in our approach. And I'm glad to say that the church is starting to rally itself around this particular problem and identify it. In fact, there are 3 issues that the church identifies as, or 3 focal points that the church has identified. The first is we believe that we really need to work with our pastors and congregations to educate so that we understand the nature of this disease. Secondly, we want to focus on our educational system. We have a large network throughout the world where we have students in our own schools. And we know from studies that are being carried out that our students in our own schools are at risk by reason of their sexual behavior, of their drug activities. We know that they're better than in the non-Christian schools, but they are not as good as we would like to see. We need to put a tremendous focus through our teachers, through our education systems, in our seminaries, so that our future generation of pastors will be well educated in this. And the third thing that we need to do is we need to mount our network of hospitals, clinics, and health providing agencies, be they self-supporting, be they under the auspices of the church. We need to unite ourselves with a common thrust to educate, to care for, and perhaps to select a few very definite projects that we can implement. And by selecting them, because we can't, there's no way that the church can address this problem worldwide as though we can do it.
It's a multi-billion dollar...
Multi-billion dollars. I mean, it was calculated at the United Nations when they met just a couple of months, I can't remember exactly how long ago, at the United Nations there, they had this big meeting together. They estimated that it would cost about $3 to $4 billion per year to put teeth into this. Now, the United States very generously said, we will give $200 million.
Drop in the bucket.
But it's a drop in the bucket compared to the problem. So people of faith, people of goodwill everywhere, we need to put our minds and our hearts together to address this problem.
You know, you're a Christian physician, and you're a physician that helps physicians, marshals physicians, and all these different things. You work as a part of a global network to bring hope. But, you know, you talked about that 22-year-old you were at the bedside. What type of hope and help and spiritual thing do you bring to the bedside with someone or a family that is already afflicted with this? What can you tell us in our last minute here?
Christianity is a message of hope because we have a Savior who's paid the price. It's all paid for. And heaven is waiting with arms outstretched to receive repentant sinners. It doesn't matter how bad our sins or how lewd our actions. It doesn't matter what we have done. Jesus has paid the price, and He's willing to receive us and to take us home to heaven. If we could only catch just a glimpse of that love, you know, because I believe that whatever we do, whether we prophesy, whether we preach, whether we make these programs, you know, whatever we do, the underlying thing is love, because love endures all things, and love never faileth. And the love of God is poured out to us, His erring children. And that's my hope and my trust is in a risen Savior, Jesus Christ.
We've been talking with Dr. Alan Handysides. He is the head physician of the World Church of Seventh-day Adventists. We hope that you've enjoyed this program on AIDS, and we hope that if you have problems, know people that are suffering from this problem, that you will contact your local church congregation and that you will actually be involved in bringing hope and healing.